Time now to go inside your health. It's been a week since O.J. Simpson died of prostate cancer. He is one of the 35,000 men who will die of the disease this year. Not all men, though, have the same risk. According to the CDC and the American Cancer Society, black men are more likely to be diagnosed and to die from the condition. Experts at the Prostate Cancer Foundation are now calling for earlier and cleaner prostate cancer screening guidelines. So we have our health expert, Dr. Arkel Georgiou, here with us today to lay out some of the facts. Why is it that black men are getting prostate cancer more often, and how much higher is this rate?
Yeah, so we don't exactly know why black men get prostate cancer more often. Certainly there can be environmental, lifestyle, access issues, discrimination issues, stigma issues. But even in studies that try to control for all of that, there may be a genetic link that puts black men at higher risk. And so let's look at some numbers. If we look at the risk, the lifetime risk of prostate cancer in white men, it's about 1 in 8, so that's a little over 10%. But if we look at the lifetime risk of prostate cancer in black men, it's almost 15%. That's 1 in 6. Then if we look at the risk of dying from prostate cancer, black men have over twice the risk of dying from this condition as opposed to white men. If you look at Asian men, all of the statistics are even lower than white men. They're just not as clean as for white men. And so one of the statistics that we see is black men get it earlier, about 2 years earlier. They get it more, as we just talked about, and they also tend to have more aggressive cancers.
Wow. Okay. I feel like you hear so much about prostate cancer screening, and so many men in our lives have gone through the screening. They check in with their doctors. But now we're hearing about some proposed changes to the guidelines and maybe clearer guidelines, in fact.
Sure. Well, and so I think one of the reasons why we have guidelines, but maybe they're not followed as closely, is that they're not always clear enough.
Okay.
So before we talk about what the new recommended guidelines are, let's just look at the current guidelines, because I want to point out how vague they can be, and especially for black men. So if we look at the U.S. Preventive Services Task Force, this is a government-appointed task force. It's what insurance companies rely on to decide what to cover. They say that all men on average should start at the age of 55. They should get that PSA test periodically, but they don't say what that period is, so they don't mention anything about that. And then they have this vague line in there that says that African Americans could consider earlier screening because it offers a potential mortality benefit. Well, what the heck does that mean? So there's no clarity on what men should do who are overall, and particularly black men. If we go to the American Cancer Society, let's go to their recommendations. A little bit better. Men should start at the age of 50 overall. The frequency should be every 1 to 2 years. African Americans, though they point out specifically, should start at the age of 45. So let's fast forward to what the Prostate Foundation is now recommending.
Okay, so the new recommendations that are more clear.
Right, so here we go. And they really only address recommendations for African Americans because of the statistics we talked about earlier. They say to start at between age 40 and 45, get tested every year, and if you have a family history, a first-degree relative of prostate cancer, you should absolutely start getting tested at 40, not wait that extra 5 years, and you should get tested every year until the age of 70.
Okay, smart. Stay on top of this. And real quickly before we wrap this up, if you've been diagnosed, there are lots of treatment options, aren't there?
Right. There are lots of treatment options. And even with the most aggressive form of prostate cancer, it's not an emergency. And so the two general categories are prostate surgery, removal of the prostate, as well as radiation. But within that, there's lots of options. So I had a colleague who got 8 different opinions on what to get before they decided. I would really recommend not rushing into any single treatment approach until you're sure that you know all your alternatives and do the one that's right for you.
Arkel, so important to talk about this. Thank you so much. We'll be right back.